Hello, my name is Dr. James Shamiyeh. I'm a pulmonary and critical care physician and also Senior Vice President and Chief Operating Officer at the University of Tennessee Medical Center. This is my 8th week providing a COVID-19 update from the hospital perspective. Today we're going to review some hospital data, and I'm going to focus more on the death rate and its implications than I have in prior weeks. And then we're going to talk about the vaccine a little bit. There's been a lot of news and developments related to the vaccine, including boosters last week, and we've gotten a lot of questions because there's some confusion. And so I'm going to try to make that as simple as possible. So here we see the hospitalizations across the region, and the region is defined by the counties at the bottom of the slide. The purple line shows all the patients in the hospital across those counties each day. And what you see that a few weeks ago, those hospitalizations peaked and then plateaued, and now it started to drop. The red line are patients in the intensive care unit. The blue line are patients on the ventilator. What you see with those lines is that they have plateaued, but they are not really dropping as fast as the purple line. And that's been, again, one of the distinctive things about the Delta wave surge is we've seen more patients in the intensive care unit and more patients on the ventilator. This is data from our hospital. First, you see that we have 83 patients with COVID-19 in the hospital. Just to remind you, 2 weeks ago when I presented to you, we had 164 patients, and last week we had 124 patients. So this is definitely a significant drop, and we were pleased to see this. This drop, we feel, is primarily driven by fewer patients with COVID-19 being admitted to the hospital, which is good news. But we've also seen an increase in the number of deaths. And that's the way that the pandemic has always behaved. Initially you see an increase in cases, then you see an increase in hospitalizations, and then you see an increase in deaths. And so, for example, in the last 60 days, we've admitted 918 patients with COVID-19, and out of that 918, there have been 86 patients that have passed away. So I want to try to put all that in perspective. And these next few slides are from a group called the Joint Commission, which is a medical group, and honestly they were the best things that I've seen to try to visually depict the mortalities and the deaths related to COVID-19. So we're going to use our frame of reference to be a football stadium. And what this shows is that on average, how many traffic fatalities occur in the United States each year, and that's about 38,000, which as you see fills just over 60% of the stadium. We know that it's about to be flu season, and the flu is often brought in conversations about COVID-19. So how many flu deaths happen in the U.S. each year? Well, this is the average over the last 10 years. It's about 36,000 deaths. And so you see it fills just slightly less of this football stadium. Then when we talk about COVID-19, and this goes all the way back to January 2020, so it is more than a single year, you see that, first of all, on the left-hand side, there are 7 football stadiums full of deaths. And that is those are the deaths before the vaccine became widely available in February of 2021. Then on the right-hand side, you see the 3 stadiums, and that's up to August 18th, the deaths that occurred after the vaccine became widely available. And by the way, if you look at that as of today, there's been an additional stadium added, an additional 76,000 deaths. And then you see just that arrow, the group behind the end zone of that one stadium, that's the number of deaths among vaccinated people. So this really shows and puts it in perspective just how effective the vaccine has been at preventing deaths from COVID-19. So vaccines have gotten even more complicated in the past week with all the discussion of boosters. And so we've gotten a lot of questions about that. So let's try to make that easy. So first of all, what does it mean to be fully vaccinated? Well, this has not changed. And so for Pfizer, that's 2 doses. And remember, that is the only fully FDA-approved vaccine for those aged 16 and older. But it has an emergency use authorization, which I'll call an EUA, for age 12 to 15. The 2 doses of Moderna are under an EUA for age greater than or equal to 18. And the Johnson & Johnson, still a single dose, also an EUA for greater than or equal to 18. So then this came out several weeks ago. It's the 3rd dose for severely immunocompromised patients. So this is for people who have had an organ transplant or have the equivalent amount of suppression of their immune system. And the reason for this is there was concern that the initial 2 doses did not create enough of an immune response. And so they're eligible to get a third dose at least 28 days after the second dose of Pfizer or Moderna. Now, for this group of people, they likely have already been in contact with their doctor, and if not, they likely should. This is not the booster that was just approved last week, and that's what we'll talk about next. So for boosters, this is a third dose at least 6 months after the completion of the original series, and it's only been approved as an EUA for Pfizer, not for the other vaccines. Per the CDC and the Tennessee Department of Health, people 65 and older and residents in long-term care facilities should receive it. People 50 to 64 years old with underlying medical conditions should receive it. Then people 18 to 49 with underlying medical conditions may receive it based on their individual risk and benefits. And then those 18 to 64 who are increased risk of exposure due to occupational or institutional settings may receive it. And so the difference between should and may really is in terms of a level of recommendation, but this is really all the people that are eligible for a booster. Now, I've not mentioned specifically things about Moderna or the Johnson & Johnson vaccine simply because I am presenting to you today only the things that are definitively approved, not things that are potentially in the pipeline. So then what are these underlying medical conditions for the Pfizer boosters? Well, I'm not going to read through all these, but this is the list from the CDC's website and it can be referenced. But as you see, it's quite an extensive list. So then the next question we get is, what about the flu shot? I'll emphasize that flu vaccines are very important this year. Even if the COVID-19 cases and hospitalizations continue to improve, adding a bad flu season on top of COVID-19 could again overwhelm hospitals. And importantly, and we get this question a lot, you can get a COVID shot, whether it's a booster or part of the original series, and your flu shot at the same time. That way it ensures you've gotten both, and if that's the easiest thing for you to do, it is fine to do. So if you're still not sure, what we recommend is that you ask your healthcare provider. There's a lot of moving parts here, and if you need further advice, then you should reach out to your healthcare provider. So to close today, what I'd like to say is that very importantly, even with the numbers that we see are improving, which is great news, it still doesn't mean that the individual patient can't have the same level of detrimental effects from COVID-19. The way it affects a person is the same regardless of whether the COVID-19 cases are rising or whether they're falling. And so the way we close every one of these videos, still important today, steps to end the pandemic. We strongly encourage vaccination. If you're the slightest bit sick or concerned you might have COVID, please get tested and stay away from others. And then also, still important to protect yourself immediately, wear a mask. So as always, we appreciate your time and attention, and we'll visit with you again next week.